Hello everyone, my name is Mary Markarian and today I'm gonna give a presentation on phenylketonuria. Phenylketonuria is a hereditary disorder characterized by a metabolic error in the breakdown of phenylalanine. It is inherited in an autosomal recessive manner and is mainly brought about by pathogenic mutations in the phenylalanine hydroxylase gene, which is located on chromosome 12, that encodes for the synthesis of the enzyme called phenylalanine hydroxylase. Phenylalanine hydroxylase plays an important part in the conversion of phenylalanine to tyrosine, which is dependent on the co-substrate tetrahydrobiopterin, or just BH4. Phenylalanine hydroxylase malfunction causes phenylalanine buildup in the blood, resulting in increased amounts of this amino acid in the entire body. This buildup can cause various symptoms and complications associated with phenylketonuria. Phenylketonuria was first recognized as a distinct medical condition in 1934 by a Norwegian physician, Dr. Folling. He identified the presence of phenylpyruvic acid in the urine of two siblings and subsequently observed the same substance in mentally disabled patients. This discovery not only marked the birth of phenylketonuria, but also represented a paradigm shift in our understanding of inherited metabolic disorders. Dr. Folling's work unveiled phenylketonuria as the first disorder known to affect cognitive function due to an inborn error of metabolism. This disorder is characterized by elevated levels of phenylalanine in the blood and brain, which may induce a range of symptoms. The most noticeable consequences that significantly impact a person's quality of life include intellectual disability, seizures, and behavioral difficulties. Other signs of this condition include eczema, as we can see in the pictures, microcephaly, and also these patients have light skin and hair, and musty stench in the breath, skin, and urine, which is something that is unique to phenylketonuria patients. It is important to note that the severity and range of symptoms may vary among persons affected, reflecting the condition's heterogeneity. Recognizing and comprehending the various clinical phenylketonuria presentations is critical to identify the disease early, intervening and using the appropriate treatment techniques to reduce its consequences. The fundamental principle of a phenylalanine-restricted diet is central to therapies and treatments for phenylketonuria, because phenylalanine is an essential amino acid that the body cannot generate. Its levels must be managed by diet. Natural protein sources are substituted with customized protein replacements that are phenylalanine-free but high in tyrosine. Low-protein food items, mainly carbs and lipids, are also included to give balanced nutrition. However, close monitoring and specific diet customization are essential to avoid side consequences such as growth limitation, anorexia, baldness, and lethargy, which may arise from insufficient protein and phenylalanine consumption. Furthermore, pharmaceutical therapies are critical in lowering blood phenylalanine levels. Currently, sapropterin dihydrochloride and pregvalase are the most often utilized medications. Sapropterin dihydrochloride increases the activity of phenylalanine hydroxylase, and pregvalase, on the other hand, breaks down phenylalanine. These drugs supplement the food regimen and improve phenylalanine management, reducing cognitive deficits the deficits and other difficulties associated with this condition. The current studies and clinical trials in phenylketonuria aim to explore various avenues for improved management and treatment. These areas of investigation include the development of innovative therapeutic approaches such as gene therapy, enzyme replacement therapy, and strategies involving tetrahydrobiopterin supplementation. Researchers are actively working to enhance diagnostic methods, investigate the impact of phenylketonuria on neurodevelopment, and identify potential biomarkers for monitoring disease progression and treatment efficacy. One of the current studies was the investigation of gut microbiota in phenylketonuria patients. So this study targets to investigate the composition of gut microbiota in phenylketonuria patients as compared to people who are healthy. Stool samples were amassed from 8 patients suffering from phenylketonuria and additionally collected from 10 healthy participants. The results indicate that there are a significant difference in the microbiota in the gut for the two groups. Phenylketonuria patients have higher phenylalanine in the gut, showing a potential role of gut microbiota in the development of phenylketonuria. This research highlights the importance of studying the gut microbiota in phenylketonuria and its potential for developing new treatments. In conclusion, phenylketonuria is a hereditary condition that arises due to mutations in the phenylalanine hydroxylase gene, leading to the diminished or absent function of the phenylalanine hydroxylase enzyme. This enzymatic deficiency is responsible for the manifestation of the disorder. Prompt identification and timely initiation of a low phenylalanine regimen are crucial in managing symptoms and reducing potential complications linked to phenylketonuria. Continued research endeavors exhibit the potential for enhancing our comprehension of the ailment and devising more efficacious therapies to ameliorate the standard of living for individuals affected with this condition. And here's my resources, and that concludes my presentation. Thank you so much.